my dear budding doctors. I welcome you all to my YouTube channel, Medicos Notes. So, this is the third part of our video, the important short answers of upper limb. I hope you all love the previous videos. So, please support our channel. Please look onto the videos. It will be very useful for you. Okay, now let's move on to the video. The first question we are going to discuss is a median nerve of hand. So, the median nerve is one of the five main nerves originating from the lateral and medial cord of brachial plexus. So, the lateral and medial cord of brachial plexus give rise to median nerve. Okay, the second point is that it supplies the muscles of friend of forearm and muscles of thenar eminence. So the muscles of friend of forearm and the muscles of thenar eminence are supplied by the median nerve. The third point is that it controls the coarse movements of hand and hence is called the laborous nerve. So the fine movements of hands are controlled by the median nerve and hence it is called the laborous nerve. Okay. The fourth point is that the median nerve passes through the carpal tunnel, and when there is a compression of nerve in carpal tunnel due to overuse by activities, it causes carpal tunnel syndrome. So the carpal tunnel, it comes somewhere around this area, and when there is a compression of nerve in this carpal tunnel due to overuse by activities can be like writing. So mostly in writers, they come of carpal tunnel syndrome. Okay, the fifth point is that median nerve distribution is given. So even though they have asked the median nerve of hand only, you can also draw this diagram which is given the median nerve distribution of the whole upper limb. There is no any harm in that. But anyhow, you have to draw the diagram and explain. Okay, now let's move on to the next question. So the next question is the flexor retinaculum of hand. So this is the flexor retinaculum of hand and the relations, and this diagram itself is very important. If they have asked this question, you can if you alone draw this diagram, if you explain this relation itself, you are going to get the whole marks. Okay, so please practice this diagram very well. Now let's look on to the points. So the first point is that the flexor retinaculum is a thick connective tissue which forms the roof of the carpal tunnel. So the roof of the carpal tunnel is actually the flexor retinaculum, and it is a thick connective tissue. Okay. The next point is that the carpal arch is turned into the carpal tunnel by bridging the space between the medial and lateral parts of the arch. So the medial and lateral parts of the arch are connected by bridging the space between them, and this is called as the carpal tunnel. Okay. Now the attachments. So for attachments, you have to draw the diagram and explain. Okay, so medially it is attached to the pisiform and hook of hamate, and laterally it is attached to the tubercle of scaphoid and the crest of trapezium. Okay, so the fourth point is the structure passing superficial to flexor retinaculum. So what are the structures passing? First one is ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve, tendon of palmaris longus, palmar cutaneous branch of median nerve, superficial palmar branch of radial artery. Even though it is very difficult to mug up like this, if you draw the diagram and if you know by heart the diagram, it is very easy for you to write the structures passing superficial and deep to the flexor retinaculum. Okay, so the fifth point is the structure passing deep to the flexor retinaculum. So like listen everybody, this structures passing deep to the flexor retinaculum is itself a very important 2 mark question which has been asked very frequently in our board exams. Okay, so structures passing deep to the flexor retinaculum are tendon of flexor digitorum superficialis, tendon of flexor digitorum profundus, tendon of flexor pollicis longus, and the median nerve. So the structures passing deep to the flexor retinaculum is very important. It itself is a 2 mark question. Please look onto this. Okay, so please draw this diagram, explain the structures, explain the attachments, explain the structures deep and superficial to the flexor retinaculum. It is more than enough. Okay, now let's move on to the next question. So next question is the thenar muscles. So they have asked repeatedly, what are the thenar muscles in our body? Okay, so the mnemonic is that all flew away. So means A corresponds to abductor pollicis brevis, O in owl corresponds to opponens pollicis, F in flew corresponds to flexor pollicis brevis, and away A corresponds to adductor pollicis. Okay, the next question. ulnar claw hand. So I have just given this diagram for your better understanding. So the first point is that ulnar claw hand is an abnormal hand position that develops due to lower ulnar nerve lesion. So the lower ulnar nerve lesion or injury can give rise to the ulnar claw hand. Okay. Now what happens here is there is flexion and clawing of fourth and fifth fingers. So the flexion and clawing of fourth and fifth fingers, when you look it up, appears to be like a claw hand. Okay. The third point is that this results in unopposed extension at MCP joints and unopposed flexion at IP joints. Now moving on to the next question. First, carpometacarpal joints or corpometacarpal joints itself can be asked as a question. Also, it is a very frequently and repeatedly asked question. So please look onto this. Okay, you can draw this diagram. You can explain the attachments. You can explain the diagram very perfectly. Also you can write or 4 or 5 points for a 2 mark question. It is more than enough. Okay, so the first point is that the carpometacarpal joints are articulations between carpal bones and metacarpal bones of hand. Okay, second point is that there are 5 CMC joints in total, and out of which the carpometacarpal joint of thumb is the most specialized and the most flexible one. Now the third point is that what is the type of this first carpometacarpal joints is a saddle variety of synovial joints. Fourth point, articular surface of the carpometacarpal joints. First carpometacarpal joints. Okay, so the distal surface of trapezium and the proximal surface of base of first metacarpal bones form the articulating surface of first carpometacarpal joints. The ligaments. So what are the ligaments that help in maintaining this first carpometacarpal joints are capsular ligament surrounds the joint, the lateral ligament strengthens the capsule, the anterior ligament and the posterior ligaments, okay, all help in maintaining the structure and strengthen this capsule and the joint. Okay, now the sixth point is the blood supply. So what is the blood supply? Radial vessels supply blood to the synovial membrane and the capsule of the joint. Then the nerve supply. First digital branch of median nerve. So median nerve gives a nerve supply to this carpometacarpal joints. Okay, now moving on to the movements that is caused by the carpometacarpal joints. So flexion is caused by flexor pollicis brevis and opponens pollicis. Extension is caused by extensor pollicis brevis and extensor pollicis longus. Okay, now the third movement, that is abduction is caused by abductor pollicis brevis and abductor pollicis longus. Now the fourth, adduction. So adduction is caused by adductor pollicis. Fifth, opposition is caused by opponens pollicis and flexor pollicis brevis. Okay, so I have given altogether of a 15 question, and these 15 questions, if you revise thoroughly, at least 80% of the 2 mark that is coming for exams, you can answer it. Okay, so wishing you all the best of luck for your exams, and keep supporting my video. Subscribe, please like the video, please comment your suggestions, and thank you all for listening. Thank you, doctors. Thank you.